Welcome to our final day of the 2023 forum. If you missed Wednesday, I'm Priya Bathija, and I am a member of the 2020 Mom Board of Directors. This morning, Joy and I are very excited to unveil something big. As I shared on Wednesday when we kicked off the forum, the 2020 Mom Board approved a strategic plan that leans into our organization's unique strengths, like convening and connecting cross-sector payers, what we call our 4 Ps, informing legislative policy at the state and federal level, and providing technical assistance on policy and practice changes for partners like state Medicaid agencies, state-based nonprofits, and others. With that work, we recognized it was time to have a name that aligns with these strengths and the work that we are leading for the field. To that end, we're excited to tell you that today, 2020 Mom is changing its name.
Yay, yes. Yes, today we become the Policy Center for Maternal Mental Health, formerly known as 2020 Mom. Over time, you will start to see our branding change and a new website unveiled, and I hope you are as excited as we are. Before we get into today's program, I'll quickly recap yesterday's highlights. We started with a story and a panel on the Native American and Alaskan Native communities who've been harmed and are starting to be helped in a beautiful community-based way. We've also heard from HRSA on their programs and funding opportunities and honored the CDC's reproductive division as the 2023 Maternal Mental Health Hero. Then closed our main stage with a fascinating panel on emerging treatments and tests. Our day concluded with 5 breakout sessions and topic networking sessions, which I hope you all had a chance to take advantage of. Those recordings of the breakout sessions will be in the Whova app starting Monday and added throughout the week. Next, I'm very excited and honored to co-present a session titled Maternal Mental Health National and State Policy, a year in review and what to expect in 2023. I'm honored to co-present with my colleague, Katrina Velasquez, the principal of our federal lobby, lobbying and public affairs company, Center Road Solutions. She specializes in turning partisan social issues into non-controversial bipartisan issues that both Democrats and Republicans can get behind, and she drives them across the finish line. You can read more about the policy wins she and her team have helped attain for nonprofits like ours in her bio. Today, Katrina will share the federal maternal mental health legislative work that occurred over the past 12 months and what we're looking at in 2023. And I will then follow with a presentation on state policy and what's occurred in the last session. Welcome to the main stage, or welcome back to the main stage, I should say, Katrina. It's great to have you back at the forum.
Yes, thank you so much, Joy, and congratulations to the Policy Center for Maternal Mental Health. Very, very exciting name change. So congrats there.
Thank you.
Well, we can go to next slide. So, I'm really excited to be here today to talk about all of the amazing work that the US, as well as the state congresses and legislatures, have achieved last year. I kind of started calling last year the year of the mom as it related to maternal mental health, because there was a very large historic number of maternal mental health policies that were passed last year. Some of which maybe you heard from the Policy Center for Maternal Mental Health, their partners, or maybe you didn't hear it because oftentimes we only hear the bad stuff. So let's talk about the good stuff that happened here. So the first element that was passed, and really hats off to 2020 Mom, which is now the Policy Center for Maternal Mental Health, but was really a piece of legislation that was designed to fill the gaps in federal and state governments. And so this bill was called Triumph for New Moms Act, and it passed into law in December of this past year. And kind of just big picture, what does this do? What does this mean? It creates a federal interdepartmental task force to really do a big landscape review of what the federal government is doing around maternal mental health, identify where there are gaps, as well as make policy recommendations to both federal and state governments through their governors. And so, this would allow for public comment, but it's really designed to make sure that we're having a lot of cohesion, because I think any mom here or provider here knows that there are gaps not only at the local level, but there are definitely gaps at the federal level. So this is really designed to close a lot of those gaps, as well as create a strategy going forward on how the federal government should be looking at maternal mental health policy. So congrats again to 2020 Mom, the joy for your leadership in getting that across the line. I will personally say all of the advocates who participated were essential, especially last May, into getting this passed. So thank you. Next slide. A next piece of legislation that was passed was called the Into the Light for Maternal Mental Health and Substance Use Disorder Act. This also was passed in December, and really kind of big picture what it does is this is really providing funding to states to increase screenings and interventions for moms. And so that's a real simplistic way of saying this, but really it's a combination of things like training maternity care providers on how to screen and refer for care, having kind of what we call a phone the friend, a psychiatric access line for providers like OBs or midwives to call when it comes to potentially prescribing prescriptions, as well as some other coordinating activities for states to do to better increase the amount of screening and intervention for moms. This was actually a bill that was originally authorized back in, 2014, 2015. Now my memory is a little soft here, which was actually led by 2020 Mom. And the Maternal Mental Health Leadership Alliance picked up this torch and ran hard and fast towards it. And we're just forever thankful for them getting this reauthorized for another 5 years, and then expanded from the original $5 million per year to up to $24 million per year. So more states can now participate in this program. And then along the same line, I don't need to get you too into how Congress works, but they actually do funding packages for each year. They doubled the amount of funding for this program for this period. So originally it was $5 million as it was authorized. For 2023 is $10 million. So hats off to MMH LA for your leadership here. Next slide. And similarly, which in that bill that was passed, that we just talked about, the Into the Life for Maternal Mental Health and Substance Use Disorder Act, it also it also authorized the Maternal Mental Health Hotline for 5 years at $10 million per year. So for those of you who may have not heard of this hotline, this is a hotline that provides 24/7 support for moms via voice and text in Spanish and English, with actually licensed counselors. So this is really kind of meant to fill the gap when you can't be seeing your provider, you're up late at night, maybe you're breastfeeding and you're just really struggling. This is kind of meant to be that bridge before, kind of those really rough time periods till you go and get help with your provider. This was originally funded in 2021. And so the funding has expanded, and now we will for sure see it continue for an additional 5 years. Okay, next slide. And then one of the final big things was a grant program was included in for community-based organizations to help diverse mothers. So think about Black and Brown mothers at the community level. This was funded through HHS's Office of Minority Health for 2023 and was funded for $7 million. Hats off to Shades of Blue Project. They really took the lead and partnered with organizations like 2020 Mom to get this across the finish line. But this was a really big step. I know a lot of us were advocating for the Moms Matter Act, and this is kind of like a smaller step towards that. And any money in maternal mental health is good money in maternal mental health. So hats off to Shades of Blue Project for that work. Next slide. So looking at, what some of these groups are doing for this coming, what we call Congress, congressional period, which actually is a 2-year period and not a 1-year period for federal government. So for 2023 and 2024, the items that are occurring right now are new legislation and new work around maternal mental health in the military. So looking at female service members and their spouses. And this really goes back to a GAO report, a report that was released last June, which actually showed that 1 in 3 active duty service women who were moms actually experienced a maternal mental health condition. And their spouses were actually around the same. So they're kind of much more affected than other populations of mothers. So really kind of focusing on this vulnerable population. Another area of policy that organizations are working on are increasing funding for provider trainings and the maternal mental health hotline. So the things that were just passed at the end of the year, every year we need to keep asking for more money. So that is one of the initiatives that continues, as well as ensuring issues around maternal and maternal mental health to include diverse perspectives of mothers of color, as well as community-based organizations that are often treating them. So this is really making sure that anything that's going forward really does have that kind of diverse angle to it. And then honest, realistically, the maternal mental health groups in the field, as well as other groups like in the maternity infant care world, are always doing so much in this space. So I am sure there will be much more. So come back next year and we'll tell you more what's going on. Next slide. All right.
Wonderful. Well, thanks so much, Katrina, on behalf of all of the advocacy organizations for your leadership. Truly could not have done it without you. And as Katrina mentioned, to all of you who may have taken action in some way this past year to get these 3 important bills and authorizations across the finish line. Katrina has listed her email here, and you're also welcome to email the advocacy organizations directly, of course, as well. And so I have the pleasure, and thank you, Katrina, again, of going through what happened at the state level. And we can move to the next slide. And one more slide in, there we go. And I wanted to start by just acknowledging that there's been some fantastic traction at the state level around maternal mental health. And that's largely been in part to these amazing people on the screen. And there's more of them that you can check out on our Policy Fellows web pages on the Policy Center for Maternal Mental Health website. These are policy fellows that have been meeting in cohorts for the last 3 years. 1 year, cohorts run for 1 year each. We have a government agency fellows program with departments of public health, the state level, some local departments as well, or county-based departments, and also Medicaid agencies, for example, a couple of behavioral health departments. It's been fantastic to convene them and learn from them and make sure everyone's connected on what best practice looks like at the government agency level, at the state or local level. And also nonprofit backbones have been convening for 3 years as well. This is our last cohort that graduated last May. And we want to just say thank you to them, and you'll get to see some of their great work as I proceed through the slide deck. Last thing I must say is that this program has been made possible from the generous support of Sage Therapeutics, one of our sponsors of the forum. Next slide. So we wanted to talk a little bit about the Policy Center, or 2020 Mom, formerly 2020 Mom's recipe for state policy. Some of you may remember that 2020 Mom was the organization that was behind the passage of a comprehensive bill package that passed in California, 4 bills in 1 year. And we received many calls about, well, how did you do it? How can you help us? And it really was the impetus for the fellows programs. And we wanted to share our recipe, what we did with all of you. And this is what we teach our backbone nonprofit organizations in the fellows program. Before I get into each of those steps, though, I wanted to just share, as much as we see federal policy happen around maternal mental health, that the states play a critical role. Aside from large comprehensive healthcare packages like the Affordable Care Act, it's largely states that have jurisdiction over healthcare policy. And so it's critical that we jump in at a state level as well. And I also wanted to share that state regulators like public health departments, sometimes Medicaid agencies, and for sure insurance agencies that have oversight of payers play a critical role in shaping health policy, but often they need what's called authorizing legislation to give them full jurisdiction to direct programs or create new regulations. So it's important that we engage at the state level and engage these players. So what we suggest for state policy and legislative policy change is to start with a stakeholder meeting, convene cross-sector stakeholders like all of you at the state level, and then issue a resolution. You can sometimes do the second step first, issue a resolution declaring May Maternal Mental Health Awareness Month. We'll talk about that in just a moment. And then a law or a resolution calling for the formation of a task force or a blue ribbon commission to study maternal mental health care, just like we heard at the Triumph for New Moms Act is going to convene multiple agencies and experts to study maternal mental health and look at gaps at the federal level. States should really be doing the same. Number 4 is to run that blue ribbon commission or task force. And then number 5, issue a report and also distribute requests to cross-sector organizations with strategies that they can take. And then the 6th step in the menu is, or the recipe rather, is for the legislature to take action around filling those gaps and introduce legislation as needed. Next slide. So a few tools that we provide at the Policy Center to make all of these things feasible. Here's an invitation for that first step. We can go to the next slide. We also have model legislation on the awareness months, declaring May Maternal Mental Health Awareness Month. Here's an example of a state that has been doing this almost annually, Michigan, one of our fellows program participants. We also have a resolution to form a task force or blue ribbon commission. So all of that language is available now on our website. We used to just provide this model legislation to our fellows, but we're now making it available to legislators directly. Next slide. For those that are running task forces or commissions, we have a community action toolkit, which is really a recipe for convening cross-sector stakeholders, doing a needs assessment, et cetera. This program was funded by our first funder, the Zoma Foundation, also a sponsor of this event. Next slide. We also provide a template task force report or commission report, similar to the report that was issued out of California. We thought we can easily update citations and put placeholders for content to make it easier for states to run these important commissions and task force. Next slide. So I already mentioned that we have template policy or model legislation. We have model legislation on these topics. So we talked about awareness resolutions. We talked about the third item there, blue ribbon commissions or task force. But we also have model legislation that was, most of this was introduced in California. Some of it wasn't, including a screening mandate, what that can look like, that language It first came out of Illinois, I need to acknowledge. We added some additional language like what insurers can do around case management programs, for example, or in developing more comprehensive plans for maternal mental health. And then we developed insurer network adequacy legislation. We'll talk a little bit about some of that in the mental health parity session that's coming up soon. And this actually came out of a request from the Medicaid agency through our fellows in Arizona. So thank you again to our fellows for their leadership. And just to remind everyone that we really think good policy is strategic and sequenced and includes some sort of oversight and public reporting requirements. Next slide. So I wanted to also reframe all of us into thinking about the role of the obstetrician. On Wednesday, rather, our first day of the forum, we had the good fortune to really think about the role that pediatric providers can play and how to bill Medicaid for their critical role in providing interventions, not specifically treatments for mothers suffering from postpartum depression or other maternal mental health disorders, but interventions that wrap around families to really protect them from suffering from maternal mental health disorders. So now I wanted to sort of recalibrate a bit and think about why we might also want to move upstream. And I know many of you certainly understand this, but move upstream to the obstetric setting. And that's the OBGYN or the midwife, and sometimes even family practice providers deliver babies, particularly in rural settings. So the obstetric provider is really considered the medical home for the perinatal period and for the mother. And we believe it's critical to support OBGYNs and midwives in doing this important work, in part because these disorders, as we heard from Dr. Nonax on Wednesday, onset nearly as frequently in pregnancy as they do in the postpartum. We largely hear about postpartum depression, but onset happens nearly as frequent in pregnancy. And we also, of course, have many young women entering pregnancy in their childbearing age years with pre-existing depression and anxiety that's gone untreated. And so it's critically important to detect these disorders early on. We also know that untreated maternal depression and anxiety are a leading cause of preterm birth and low birth weight deliveries. There's great research out of the University of Washington that supports that. So it's really time to focus on the medical home. Though we do believe there's a no wrong door approach. Thank you to Stephanie Telecki at the California Healthcare Foundation for really anchoring that work, that there's no wrong door, even if there is a focus and accountability for one particular provider, which is the obstetric care provider as the home base. So with that background, I want to move to the next slide. So this slide talks about the states. So not just what happened last year, but what are the states that have done something around maternal mental health screening and detection in the perinatal period. And I want to emphasize perinatal period, which means pregnancy and the postpartum period. So here are the states. We're not going to go into all of them, but you can see them here. The states that have asterisks like Arizona, Colorado, and Virginia and Tennessee are focusing on screening and detection in Medicaid populations only. The other states listed here have efforts in place that extend beyond the Medicaid population. So for privately insured women and families as well. And then there's a note here in the bottom right corner that says, what about New Jersey? Weren't they the first state to pass policy and a screening mandate? And the answer is yes. But New Jersey's law only focuses on the postpartum period. They were such a pioneer, and the research at the time was really focused on postpartum depression. So it was pioneering and critical, but doesn't yet address the perinatal period or pregnancy as well. Next slide. Oh, and also I'll share the end of my slides, which are available in Whova, and we'll also drop the session materials here into the chat. There's more information about what each of these programs provide in the exhibits of my slides. Okay, so what happened in 2022? This is really exciting. So the theme or the topic here, public awareness. So May is Maternal Mental Health Awareness Month. we saw those resolutions in Arizona, California, New Mexico, and Puerto Rico. Puerto Rico did some great work through our fellows program. So Puerto Rico, if you're on, congrats again, and for all the things that are forthcoming. Screening laws, Louisiana, they were on our main stage here at the forum, the legislator that carried those bills, and also our fellow who helped champion some of the work in Louisiana and the public health department were here last year. Louisiana and Nebraska, and also New York, who's been doing some great work around maternal mental health in the city and the state for quite some time. Insurance coverage, California and Maine. We'll talk about those bills in just a moment. And there was also a bill on loss in Illinois that we wanted to highlight. Next slide. We're going to get into some of the details. So tell me more about the awareness resolutions. In Arizona, May 2022 specifically was declared Maternal Mental Health Awareness Month, thanks to our nonprofit policy fellows from Arizona. In New Mexico, February 14th, 2022 was designated the fourth trimester care day. And specifically maternal mental health complications were called out, not just physical complications in New Mexico. Utah has again done some great work around maternal mental health and declared May 2022 again as Maternal Mental Health Awareness Month through a governor's proclamation. Can do it with the legislator or the governor. In California, another resolution was introduced, and some of you may know there was an effort and even a national effort to declare January 23rd of every year Maternal Health Awareness Day in California. That effort was also put in place, and it does address maternal mental health as well as clinical complications or medical complications. Next slide. Louisiana, we mentioned, has a new mandate that requires healthcare providers, specifically pediatric providers. They are not addressing obstetric provider screening yet. I think it's been flagged as an opportunity to perhaps modify some policy in the future, but pediatric providers screen for postpartum depression. So it looks more like the New Jersey law. It also aims to develop a network adequacy standards for providers for health insurers to implement, including those who specialize in maternal mental health. So the perinatal mental health certification designation. Thank you, Postpartum Support International, for creating that board test. Nebraska also introduced a law around screening, and this is screening by medical doctors and advanced registered nurses, and also suggests that the creation of a referral network be developed by the State Board of Medicine. We haven't seen that yet, so that's somewhat pioneering and will be interesting to follow. And New York was the first state to identify that there may be gaps in screening to detect women of color, racial, and ethnic diverse populations. And so New York is studying those states. And if I could have the next slide. We have one more slide and I've lost them. Okay, well, we're going to invite you all to review the last set of information in my slides in the Whova app. We also have dropped those into chat. And it is actually time to transition. I just wanted to say thank you again to Katrina for presenting federal policy. And then we welcome you to, oh, there's the last slide. Okay, one last slide. Quickly on California, there was an extension on a bill that was first introduced and passed by 2020 Mom to require health insurers to create maternal mental health plans. And the plan was not defined in the bill that we first introduced. Sausage making is complex, so we won't tell you why, but now it's been extended through a new legislator to specify what should be in the plan. You can read about it here. And it also does mention encourage private insurers to include doulas in their networks, which is great. And we can advance to the next slide. I think there's just a closing slide that says you're welcome to contact us at any time. Actually, the main obstetric postpartum care bill you can read about as well. It's pretty exciting. That requires private insurers reimburse obstetric providers for postpartum care, including maternal mental health care.